So interestingly enough, and I'm going to go over this, it is very dependent on your heritage, believe it or not. It's dependent upon location, right? And so there is some, right? There is some validity to people who are like from Europe, right? And they have a very certain type of generational changes that they've seen in their microbiome versus somebody who's maybe lived in the United States for multiple generations, right? Multiple family lines, that kind of thing. So this is, and again, but this is not, like, not everybody's going to have the same one, but this is going to be somewhat determined upon not only the person, the family that you come from, and also, obviously, like I just mentioned, location as well. When we think about the ecosystem, I just want you to think about also what we're trying, like what modern medicine or what even we try to do as humans, right? Imagine if, and we can imagine this, right? It's shocking what's happening in Australia, right? I mean, when we think about, what if we just wipe out an entire species, right? I mean, I'll stand up here and say, I'm not a big fan of snakes, but do I want them gone? No, I absolutely recognize their impact in the entire world, right? The reason I'm giving that example is because this is the way I want you to think about, I want you to think about this in body parts, right? The amount of times I've heard people be like, well, I took my gallbladder out because my physician said you don't really need it, right? Or I took my appendix out because my physician said I didn't really need it, right? Or there's certain organs that people are like, it's okay to remove them, you don't really need them, right? Well, same idea with your microbiome. Yes, there is sometimes a case where you have a true pathogenic bacterium that needs to be removed. But in many cases, what we're trying to get back to is that ecosystem biodiversity, right? And that is key. And why I'm putting that up there is because what we are trying to see is like, why are we doing like so many different kinds of vaccinations? Why are we doing so many different kinds of antibiotics and giving them really willy-nilly, and these scheduling protocols that we have, right? We really have to take a step back and see, what are we doing, right? Especially, and what's happening with the coronavirus, right? Here's a really good example. This is just becoming totally kind of blown into a really, really huge scale, and one of the precipitating, right, comments when you look at some of the research is, do we have like a super virus? I don't know. I'm just saying this is one of the things. Do we have a super virus, and is it because of what's happening in modern medicine or modern technology, right? So the microbiome, to really understand it, when we look at the microbiome, what we know a lot of times, right, what we understand about it is that these are these guys, right, or these girls that are laying on top of your beautiful, beautiful endothelial cells in your intestines, and they're just kind of there as protection, right? And that's what many, many people know about with the microbiome. They were here way before we were, right? And basically they are there because they get food, right? They get to travel around the body. They get to actually have this beautiful communication within themselves and within other organelles within our body. We know that it goes way beyond right now just that protective mechanism. We understand that they are super important for not only like nutrient synthesis, they help us digest our food, they actually are a huge immune support, not just protective support, but immune support in the signaling of inflammation cytokines, which are inflammation molecules that get released in the system. They are huge in how our body deals with oxidative stress, right? Oxidative stress is what causes our mitochondria to not function as well. What's your mitochondria? Just because I'm throwing words out there that I want to make sure everybody understands.
Powerhouse.
Powerhouse. It's a powerhouse of the cell. These are the organelles that are making a ton of energy. So we want to keep them as healthy and working as possible, right? So we should have, as you can tell right now, this amazing symbiotic relationship, right? They give, we take, they. Did I just say that right? They take, we get, what, you know what I'm talking about. It's like a back and forth system. And that's the way it should be. The danger that gets into place is when there is one aspect, and specifically with them, where they are basically taking more or overriding the system, and we're going to talk a lot about that. So where the microbiome lies, it's basically anything that borders your external environment. You have a microbiome on your skin, which is one of the reasons if you're fasting, we recommend not to shower. This is such a beautiful time to rebalance that amazing microbiome on your skin. You have it in your eyes, you have it down your throat, in your stomach, down the duodenum, into the small intestine. You have it all over your intestinal layer. Women in our vaginal canals, right? We have it everywhere, bladders. So they're everywhere in the system, and as you saw, it really depends on the micro and the biodiversity of it. The one thing, yeah, go ahead.
Well, I heard that you also have bacteria in your blood and in your brain as well, not just on the surfaces that.
So let's clarify that. So if you have bacterium in your blood, it's a life-threatening situation. So it's a life-threatening situation. So you do have circulating cells that are in your blood that absolutely can go to sites of infection, like your immune cells and things of that nature. This is why it's a little bit dubious, right? And it's a little bit erroneous when people are doing these blood tests, right? Showing that there is actual microorganisms in the blood. So there's that. With the brain, you have to be careful because here's the thing. Again, if we have an infection in the brain, it can absolutely be a full-on, like, so if there's microorganisms in the brain, then we have an infection, then we have inflammation.
Someone said you find the same bacteria that's in your gut in your brain.
I would,
who told me.
Yeah, so what I would back up and kind of understand is that the microbiome, when we think about the microbiome and this beautiful ecosystem, it's very much concentrated to a certain area of our body. If we breach certain types of barriers, let's put it that way, if we breach certain types of barriers, we start to get into quite dangerous states, let's put it that way, very dangerous states. That's why when we talk about, here's a perfect example, I'm just going to throw this one out there. That's why when we talk about Candida, I have a lot of people being like, Candida is systemic for me, it's like, it's in my blood. If it was in your blood, you'd be in ICU in a hospital. What it could be, and what is absolutely possible, is that Candida that is normally in your microbiome can be overgrown in your digestive system. It can be in various parts of your microbiome, like your vaginal canal. Men, you guys can have it in the bladder, right, prostate, that sort of thing. But it's not going to, but it can't be in the blood unless it's a really serious type of infection, right? Yeah, absolutely. It's a great question. So one thing to really understand, and I want this to hit home. This is not, again, this is not just a layer of protection that's on this epithelial layer that's in contact with the outside world. It is not just that. What we know and what we are studying over and over, I just saw, and I'm going to talk more about it, but I just saw some studies on just how crazy impactful the microbiome is for female hormone regulation. Like, I mean, what I'm talking about is that, you know, if we have individuals with premenstrual syndrome, endometriosis, fibroids, I mean, I've started to go into microbiome, but I haven't gone deep into like what some of this newer research is showing, how impactful it is for signaling estrogen, progesterone, testosterone pathways. It's blowing my mind as to how involved these guys or these girls are in activating immune system responses across the entire board, changing how much inflammation is in our circulatory system, our heart, our arteries, right? Of course, our digestive system, we can all wrap our heads around that piece. Neuroendocrine, like what we were talking about, but it's not that these guys are traveling to your brain. They are actually able to send signals to the vagus nerve through multiple nervous system responses where we are affecting changes in how we are thinking. Think about brain fog, right? How many people have ever had that where you've eaten, right? Yeah, eaten something, or you've had some kind of like gut inflammation, and all of a sudden you're like, this is so weird. I can't remember things. I'm not thinking appropriately, right? I can't concentrate. There's like that brain fog aspect of it. And we're gonna see there's a lot of research coming out with autism and its connection with the microbiome health, with Parkinson's disease, with early cognitive decline, and just microbiome health. This is probably why I guarantee you it's something that it breaks my heart every single time I see it. And some of you might have heard me say this before, but we have had individuals come here from nursing homes and they immediately get better. And like immediately, like they were on this road to diagnosing of like Alzheimer's, early cognitive decline. They come here and they're functioning better. They don't have urination issues anymore. I had a patient that was, I'm not even kidding you, she was peeing herself and pooping herself. She just changed her diet. That's it. That's it. She changed it to whole food, plant-based. Her incontinence went away. Like this is, I know I'm getting really excited about this, but this is how impactful it is what you guys are learning right now. I mean, it is, I'm seeing it every single day. I am seeing it every single day, but it is out there and now we're researching it. Like now there's a bunch of research coming out about the impact that this is making, and this is where it's stemming from. This microbiome that you have, this ecosystem that you have, communicates with every single cell in your body. Every single organ, I mean, it is able to change how hormones are released, how neurotransmitters are released. It's amazing. It's really, really, truly amazing. To understand how this happens, just so you can kind of reorient yourself in the body. But if you have your cell layer, and this could be anywhere in the body, right? This is the gut layer. I'm using this as an example. If you have a gut layer, if you can imagine your blood system or your circulatory system is on this side, this is the outside world. This is the opening to the outside world. So what you have is you have food coming in here. You have different, whatever it is, toxicants, medications, whatever is going through here. You have your beautiful, beautiful microbiome. There is a way that the microbiome is able to actually communicate through cells, right? And what happens is, just so you can picture how this happens, because I always need to understand how this is all working. These cells, they have almost like reaching arms, right? But it's actually receptor sites. Those receptors receive the information that the microbiome is putting out. It's almost like if I went over here and I whispered something, and then you whispered something, and then you whispered something, and then you whispered, and then it goes around in a circle. This is what happens. But instead, what happens is that whisper is going to change something for you guys, and you guys are going to break a window or something like that. And that's the actual action of that, right? Or you know what I'm talking about. So in the cell, something actionable is going to happen, which turns on some signaling. That signaling goes out into the blood. Basically, it's chemicals, right? It's like hormonal chemicals that goes out into the blood, and that's how you affect the entire system. It can travel to the pancreas, it can travel to the heart, it can travel to the liver, it can travel everywhere. Like I said, it can travel to the gonads, to the male testes, to the women ovaries, anywhere in the body. What can go wrong is basically you can have a couple of different changes that happen, right? If this is nice and biodiverse and really optimally maintained, what you can have is potentially, if you have insult after insult after insult, you can actually lower the diversity. So one of the bacterium can actually be elevated, another one can be really decreased, right? One of the other things that you can do is, like I was talking about with the good guys, we do have certain bacterium that we know about, right? It's bifidolactobacillus kind of bacterium strains. There is a pretty much overarching knowledge that these two specific bacteriodes are actually more beneficial to our health. So these are the guys that, you know what, they're not going to be opportunistic. They're not going to turn into bad guys. They're pretty good in nature.
Can you say
but,
the two names again?
Yep, lactobacillus and bifidobacterium. So if those are the two, those are basically two that are really well studied and really can be categorized as they're really not going to cause too much harm on their own. Again though, right, depending upon what's going on, if we have low diversity, right, and these guys are just totally rampant, it's not the bacterium, and this is what I want you to wrap your head around, right? It is not the bacterium that's causing the issue. It is the fact that we have an overgrowth of actually a bacterium chain. Does that make sense? And that's where the SIBO can come into play. Usually though, if we have SIBO, we have a presence of a lot of opportunistic bacterium too. What I mean by that is that most of the bacterium we have, believe it or not, or viruses, or even Candida is in this category, they're not really bad. They're actually not bad. They do this symbiotic relationship with us. The problem is they're called opportunistic because of the fact that if you give them the opportunity and the environment, they absolutely can start to release inflammatory cytokines. They can signal different pathways in the blood, in the organ systems that then create inflammation. So they can turn opportunistic, but in and of themselves, they're not necessarily quote unquote bad, right? And then of course, there's always going to be the rare strains, which absolutely, it's like you get this infection, you're going to be sick, right? You get this infection, you're going to be sick, that sort of thing. Does that make sense? Like what can cause this dysbiosis, right? This is not leaky gut. Just as an FYI, you can have, excuse me, you can have dysbiosis, which is a dysregulation of the biome without having leaky gut. Leaky gut after periods of dysbiosis happens, right? So this is the starting point. This is where it begins. When I do my leaky gut test, I do Cyrex. The reason I do Cyrex is because it tells me whether or not I have full-blown leaky gut or I just have dysbiosis. Much easier to cure and to treat if somebody just has an imbalance in their microbiome, right? I actually just had a patient, I just got her lab results back, and she has severe abdominal pain, severe digestive issues, but it's really stemming from a couple of things, hormonal issues and also dysbiosis particularly. But this is how impactful this is, and this is why I'm so excited, because all the research I'm showing is that everything that's going on with her hormonal system is linking up to what I'm finding in this leaky gut panel. So that's really exciting. But anyway, so dysbiosis is just that shift, right? That shift from how do we have a balance to what we have more or less of in not only diversity, but what's in our gut. Factors that impact the microbiome. This is probably one of the most important things. So when I go deep into somebody's history, the things I'm looking at are the ones that are the most studied that we have out there. And now there's more and more coming up, but these are the most relevant. So diet is a huge component. What there is no conflict about, and this is a huge statement, what there is no conflict about, and people cannot even publish a study that says if you eat meat, dairy, chicken, eggs, all this stuff, that all of a sudden that's going to help rebuild healthy microbiome like your bifido and lactobacillus. They can't, it's just not true. It's just not, there's studies, even the studies that are somehow promoting paleo, and it is, and you always have to wonder, it's like, how do you get from everything that you just mentioned, how are you still promoting paleo? But anyway, that's another side note. But that whole food plant-based is the best way to have the necessary non-soluble and soluble fibers that's going to be really helping not only that biodiversity, but to actually raise the good bacterium as well in your gut so that you have much more of a balance. This is why when you do water fasting, which actually helps to regulate that microbiome, and then we actually just really feed you with this beautiful, beautiful array of phytonutrients from your whole food plant-based foods. This is why people after fast do so much better, like so much better than if they just go into trying a whole food plant-based diet. Because what you're doing is you're helping to re-regulate and then basically build on that premise that you've already kind of shifted or you've already balanced the microbiome. Does that make sense with that? Yeah, go for it.
How does water fasting regulate? I would imagine it just brings everything down, but what do you mean by regulate?
So remember, your microbiome is very much connected to how you are functioning, right? So not only, you're absolutely right, because when you're water fasting, you're not feeding anything, right? You're just not feeding anything. But what you're also doing is basically that, so what I might not have said, and I apologize, thank you for catching me, is that it's not a one-way communication. So it's not that the microbiome is just communicating with our cells are communicating with the microbiome. So there is this shifting back and forth that happens. So in a fasting situation, as we are also decreasing inflammation as well, as we are decreasing certain types of food as well, what we're doing is we're creating a healing effect, right, within our cells. We know this, right? Your cells are going through autophagy, you're changing regulation of your genes. All of that is shifting what kind of chemicals are coming out of even our cells, which is then going to be altering how the microbiome is actually being set up. So again,
it's balancing it somehow.
It's balancing it. It's balancing it not only from the fact that you're not taking in some of these foods, right? But you're also balancing it based on what's going on with the cellular healing that's happening in the body. Additionally, what's going on is that, remember that opportunistic kind of thing I was talking about? When you stop, one of the most powerful things about TrueNorth, and I'm sure a lot of people here can attest to it, when is the last time you actually rested the way that you do here, right? Like seriously, like what I mean is no kids, like somebody's doing your laundry, somebody's cooking your food for you, somebody's checking on, you don't have to worry about what's going, and I would worry about what's going on in your body, but I'm like, you know, you have people checking in on you, like, I mean, it is, all you have to do is get out in the sun for 15 minutes and rest and relax, right? That's huge when we talk about the gut health component. So when you actually take that, remove that, when you remove outside toxins, what you are then doing is those beautiful cells that are more opportunistic, you are actually you're balancing them back into working order so that they are actually on your side instead of working against you. Does that make sense? So that's how it's a great question. Thank you for asking. That's how you're actually rebalancing it. So you are decreasing populations, but you're rebalancing even those majority of the guys back into being supportive to you instead of anti to you. Okay? Does that make sense? Because that was actually an excellent question. Yeah.
I have a question about when you travel.
Yeah.
Because you talked about the different cultures.
Yeah.
So let's say I go to the Philippines every other year.
Yeah.
That's gonna totally mess things up, probably, right?
It depends. Well, here's the thing. So let's pull back just a little bit too, because that's a really great question as well. So let's pull back a little bit and let's just say this: your body is super dynamic. None of these changes truly happen with just us doing this one-off kind of, like, very rarely will like one stressor event cause super shifts in our health. You going to the Philippines that one time, that's not going to cause super shifts. What will though, and this is why, right? This is why if you go to the Philippines and you say you have like a raw salad or you drink the water, why you might get sick is because that to you, because your system is not used to it, that toxin, or not that toxin, that microorganism that you're actually drinking, your body's so not used to it that it might, what actually happens is either A, it creates so much inflammation that it causes you to have GI infection, or it kind of like nudges its friends and says, let's all kind of move over and actually get into a more inflammatory state. But if you talk to some people, perfect example is even if you go to India, right? I mean, so many people are drinking like the same water. Most of them are not getting sick, right? But you potentially could be getting sick. Same idea. It's because it's not the organism, it's the organism in your body. It's because in their body, they're so used to it geographically that it's another opportunistic guy. It's just one of those guys, you know what I mean? Does that make sense? Yeah. Oh, I had another question. I'm sorry. He was right before you. So yeah.
When you're on water fasting and you don't feed anything to these organisms, won't they attack your body?
Would they attack your body?
Yeah.
No. Just any microorganism, or like you mean your
The
microbiome?
microbiome,
No.
like what do they eat at that time? Like if I'm 10-day water fasting.
You mean do they just all of a sudden start breaking their own body down? No. No. It's actually interesting, but it doesn't do that. Well, here's what I will say to that. So if we're talking about microbiome specifically and bacteria and viruses and certain types of fungi that is in there, that's a natural biodiverse kind of makeup of that. You're not going to have that specifically happen. They're just going to basically die, just die off basically. If you have a parasite, right, that is potentially could be part of that, that's where you can start to see that sort of action, like breaking down towards like type of action. But then again, a parasite, it's in the name, right? I mean, the reason why parasites are so dangerous, as I mentioned, with the microbiome, it's a give and a take. It's a really symbiotic kind of relationship, and even the negative type bad guys or the rare strains, a lot of times they're not eating you. They're just causing widespread inflammation to happen in your body. Whereas if you have a parasite, if we're talking about eating, right, they are the ones that are sucking like and pulling nutrients and breaking down like that. So if you do have a parasite, here's the thing. There's a few parasites that we've actually seen be better. Like we are able to clear them with a water fast. So I actually don't even know the mechanism of action of how potentially they would activate something in the system with a water fast. I'm gonna look it up. I will look it up. I just know that like Blastocystis hominis, which is an amoebic, I know that like some of the larger ones too, like we've actually seen pretty good results in the fact that like fasting can shift that and actually can resolve it. There's some that fasting doesn't even touch. It just doesn't even touch. But yeah, I don't. It's actually, now that I think about it, I don't know why they wouldn't kind of. But I think they probably do. Like if we think about it, because they're not like really eating, but they actually could be sucking nutrients. So you might, in a parasitic infection, you might go into like electrolyte imbalances more potentially, or something like that. So yeah, it's a good study to do. That's a really good study.
So you have, like he was saying, Philippines, or you go anywhere, you have two people traveling together. One can eat anything, anywhere, and the other person is getting sick the whole time. So more diversity in the microbiome.
There's a lot of factors, yeah. So potentially diversity within the microbiome. Potentially immune system is already kind of imbalanced and just needs to be regulated a little bit. Potentially there might be like other stressors, like you might already have somewhat of a dysbiosis that needs to that you're already walking into there with a susceptibility, that could be just offset by that change. Stressors can play a huge role. Say he's traveling to the Philippines and it's for a vacation. He's totally relaxed and it's totally great and he's loving it and it's like amazing. He's in probably a parasympathetic zone too, which is in a more rest and digest. So his gut microbiome is not on high alert. But say you might go and just maybe like you just had a couple of stressors with work. You might be thinking about how stressful it is to be traveling, like and so you're always in that sympathetic tone. That cortisol activates inflammation. You're setting these guys already towards that opportunistic bad guy. So when you introduce something, whereas his body, his immune system is already able to take it, you can't.
So it might present as food poisoning, but it's not really that. From the stressors, in that case.
Potentially, but usually if it's straight out food poisoning, that's something that's most likely going to happen to multiple people, and potentially yes, because some people, I would say, I would err on the side that if it's true food poisoning, if it's a true organelle that's causing it, it's probably more likely that person didn't eat it and you did eat it. If it's exactly the same thing, then I would be curious whether or not it was like something more in tune with like the immune system. That's a little bit tricky because it totally depends upon what it is. But yes, in overall general kind of idea around it, absolutely, for sure. Yeah. Any other questions? These are great. These are making me think. I love it. I love it. So any kind of stressors, we talked about that. One of the big things I go into, and yes, it does matter. It absolutely does matter, is I go back into even pre-birth. So what was happening with your parents? How much stress was in the life of your parents? What kind of anxiety maybe your mom was in during pregnancy? In addition to that, which does affect it because we were talking about stressors, the other thing is whether or not you were vaginally born or C-section born, right? Vaginally born is one of the first ways that we get this beautiful wave of our mother's amazing microbiome over the child. And then the other thing is we are now seeing, and it's so super exciting to me, we are now seeing more and more push to be breastfed, and I love that. We should be, I know it sounds crazy, but we should be breastfeeding up to 3 years of age, at least. But even if you can get past 6 months, that's where the recommendation now is with most of the research. But if you ask me, I think up to 3 years. I know that's harder though, now that we're like more moms are actually in the workforce and such. But that's another great way of getting these beautiful immunoglobulins into our children early on and really establishing a healthy microbiome as well. Different life stages, this is what I was talking about too. My microbiome is totally different than when I was 3 years old. It's going to be different at 80 years old as well. So different life stages is going to change how your microbiome is and what kind of shifts happen. We talked about geography. Pharmaceuticals is another big one. The drugs, this is why, if it's possible, to really think about what you put in your mouth affects your body as a whole, and that means even taking a Tylenol, right, for a headache. I'm not saying not to do that every now and then. What I'm saying is that it has widespread impact, especially when we think about all the other things. Like if we are not eating right, if we are really stressed out, if we're not exercising, and then we're doing some of this stuff, that can have much more of an impact than if we're just taking a medication. Just, you know, and even if we need it, I think it's just a really good idea to like think broadening our thought, I should say. What you eat, really, I always say this, what you eat either feeds disease or it actually combats it, right? So what I mean by that is that everything you put into your body, remember, it's causing an oxidative response, which means that you're getting free radicals. When you eat not only like artificial stuff, oils, saturated fats, all this stuff, you don't have the beautiful kind of combat of having those antioxidants, those phytonutrients, like you do when you're eating your beautiful plant-based, right? When you eat plant-based, you're still creating those free radicals from the digestive system, but then you have your beautiful B vitamins, your C, all these beautiful antioxidants that combat what's happening in the system. Why that's important, because that's a really macro scale of looking at it, but when you go into what's happening on the gut level, when you're eating these like processed refined carbohydrates, like your breads, your sugars, your any kind of meats, even the fish out there, right? What's happening is you're activating inflammatory cytokines. High levels of saturated fat that you're going to find there is going to be activating these inflammatory cytokines, which is then talking to your gut. Your gut is then going to be sending these different kinds of signals that is over time going to be causing inflammation throughout the entire body. It's not that one time, right? It's not that one time. It's what's happening on a repeated basis over long periods of time. What we do know is food that is whole food, plant-based, is one of the few things that actually can regulate your immune system such that it decreases that inflammation, and it actually starts to help promote, right, anti-inflammatory responses even from the gut level, because of the fact that you're shifting things more to the beautiful good bacteria. Also, give me 1 second. Also, the other big thing is, if you haven't heard me say it before, I'm saying it right now. There is more and more research coming out about salt, and the fact that not only is it hardening your cells, it's driving inflammatory processes in the body. We know this with MS. We know this now with RA as well. overarching adding a ton of salt to your food is absolutely driving something called IL-17, which is your inflammation towards autoimmunity. So it's not just this thing of like, oh, it's okay, I don't have high blood pressure, I'm okay to eat salt. It's the fact that it is absolutely driving inflammation process over high quantities.
Yeah, so I'm curious about gluten being up there, and is it gluten in whole grains also problematic?
Yes. Yeah. In most cases, when you look at what's going on in the world as a whole, you're absolutely going to be seeing this more. You actually see this more with what was I about to say? Sorry, I just lost my train of thought. You actually see this more, with non-organic GMO type crops, obviously, because you have that added like toxicant. But we are now finding, because of the fact that we are having with even like, say, let's just do spelt, thank you, spelt, or any kind of gluten type grain, like even like exact far rye, like we're using mono grains. And unfortunately, over time, what's happening is because of the fact that we already have this inflammation, because we're already having certain responses within our immune system that's actually driving towards autoimmunity, this is one aspect that if you're susceptible with celiac disease or even like some kind of marker susceptibility that you can check in your blood, that's already going to be driving another inflammatory response. Even people who don't have a susceptibility, over time, because of the nature of the gluten molecule, can actually shift you over time. It's not something that it definitely, what I should say is, it definitely depends upon your susceptibility level and the type, like if you're getting, like I said, organic versus like non-organic, or like heirloom varieties, that all of that makes a difference. All of that makes a difference, yeah.
How does oral sex affect your microbiome?
How does it affect?
Does it affect?
Yes, it probably does. To be honest with you, I haven't done as much research into that specifically, but what we absolutely do know is like sexual interaction, even like vaginal intercourse, that sort of thing can actually definitely change your microbiome. Depending, and it can be multiple things, so it can be definitely depending upon microbiome, what's it called? Like relationships, like relationship wise. For instance, I don't know if you ever heard of it, but it's like I've had couples that are like they're happy, they're totally happy, but it's like every single time they have sex, she gets a yeast infection or she gets some kind of like bacterial infection like in her vaginal canal. So it absolutely does shift it, and it's fine if they go for periods of time without having sex. So it probably is very similar in oral sex. To be honest with you, I haven't gone deep into the research to give you more than that, but absolutely it can shift it for sure. Yeah.
How come you have omega-3s on there?
Omega-3s?
At the top?
Oh, yeah, omega-3s on a whole. I use this to base it. This is why I kind of pulled out fish can actually be. It can absolutely still be it's higher in saturated fat as well, so it can still cause the inflammatory process. But it actually has. Do you see the red bar? So anytime you see the red bar, it's something that doesn't activate it. So notice that they didn't say that it's the salmon. They put omega-3 up there. So omega-3 drives anti-inflammatory pathways. What I'm going to pull out and just say is that while I should get a different slide, thank you. But what I should say is that omega-3, absolutely, which you can also get from your flaxseed, you can get from algae, you can get from chia seeds, you can get from all different types of sources. These are your anti-inflammatory drivers, and so this is something that's going to actually decrease inflammation. When you look at salmon, though, specifically, or you look at fish, sure, they have higher omega-3s than if you look at red meat, but they're still going to drive inflammation responses because of multiple factors, because they're still higher in saturated fats than most of the plant foods. They're also going to be toxicants like mercury involvement. So there's so many other things within it that most research, it's just like the Mediterranean diet, right? Like, you know about this. So like they're touting it and they're going, eat the Mediterranean diet, eat ton load, right? A ton load of oils, right? And that's not what's so healthy about it. Most Mediterranean diets are huge whole food plant-based, right? So it's just about understanding like where the research is. But thank you for pulling that out. Yeah, it's probably a really bad slide. I just wanted to give that the idea of like what we're talking about here. Some of the other things that really affected is antibiotics, either orally or you can have them vaginally as well, as we were talking about. Family size, believe it or not, you have when you have a larger family size, you're going to have a more diverse microbiome. You're going to be exposed to a lot more, and that exposure early on is going to be very impactful. Sanitation, one of the worst things in the world that has ever been produced is one of those hand sanitizers that everybody is using these days. Good old-fashioned hand washing has worked and will continue to work. This is creating a really dangerous kind of situation where you are constantly wiping out your microbiome on a daily basis. It's like that extreme. We talked about diet. C-sections, unfortunately, like when we look at one of the highest cases in the world, which is where we're doing a lot of research, is Brazil. I think it's up to, I want to say it's up to like 70% of the population is having C-sections. It's scary. It's scary. Even here, huh?
It's 90%.
90%.
Yeah.
90, oh my gosh.
She's from Brazil.
90%. 90%.
Yeah, but it's actually like poor people get less C-section because the public hospitals offer good quality and they're going to be paid the same price to be there and actually do the whole birth process. Then like women are, it's like almost getting culturally
Acceptable.
No, it's like, oh, why wouldn't you get a C-section? You know, it's so much easier. Just go there, just relax, take it. You know, it's something like as if it's better for you.
Wow. That's shocking. The last time I checked was like 70, around 70%, but thank you for that. So 90% of the women are getting, that's scary. It's actually scary because we're seeing it more and more in the United States. And when I just think about like cancer rates, when I think about like autoimmune, when I think about how many like severe GI issues I'm seeing in my practice right now, and a majority of them, because I ask questions like this all the time with a lot of my patients, when a majority of them either go back to having C-sections or not being breastfed early on in life, which is not setting up that natural protection long term. There was one study. There's a few studies that are showing the effects of antibiotics. There was one that did one on a 7-course of Cipro, and it found that if you start with a biodiversity like this, even just a 7-course can actually decrease your biodiversity for like months, absolutely months. The one thing that I'm unsure of, because they didn't report in the study, I have a feeling that these people weren't on whole food plant-based diets. So this is another good study for me. I would love for them to do this same thing. Well, not that I would want this to happen, but what I would want is to see what would happen if they did whole food plant-based, because I have a feeling the diversity would actually come back a little bit quicker by doing just that diet alone. But this is just, I put this in there because I want you to see how much of an impact, and Cipro is pretty intense. It's a pretty intense antibiotic, but how intense this can be on your
So I read
microbiome.
this book on the gut microbiome by these two husband and wife from Stanford, and they mentioned Cipro, and they said that the gut never recovers from that. I mean, it might, maybe a little bit, but ultimately, it never really recovers.
Here's my thing with never, and you have to understand when I see people who have come from general medical practices and come to TrueNorth and heal at all levels across the board from things that they've been told they're going to have to live with for the rest of their lives, I have a problem with never and forever, and this is not curable, and you have to just deal with this kind of thing. While they've done multiple studies, and this is not just one. I mean, this is just one of the studies that I pulled out because of just, I mean, for 8 months they saw that the microbiome was even bouncing back.
Right.
But that brings me to my point in the sense that I just wonder what would happen if you fast these patients, right? I wonder what would happen if you just put them on a whole food plant-based diet. I wonder if we were checking stress levels. Like, I wonder if we were, you know, all this different stuff that while it's super intense, and I see where they're coming from, I also don't like never, because it's like, well, your body's brilliant, and you are brilliant.
Yeah.
So like, what would need to shift in this kind of an example for that to happen?
Yeah, and they weren't disavowing whole food plant-based diet, they were pushing that. I
That's
mean,
awesome.
they,
But
yeah.
even with that, they said never.
Well, no, they didn't comment on that part, so,
I gotcha.
you know, so.
I love when they don't comment
I
on
know.
that part. It's like, that's the part we need to know. So anyway, it's interesting. Thank you for that. So how does this show up in the body? I'm just going to take you through kind of quickly, just so you can understand how these are going to show up in different ways. So one of the things I mentioned, and this is just another slide to show it, is that it can do both positive and negative, right? We can go towards increasing cardiovascular risk. We can go to decreasing short chain fatty acids, which is not building the intestinal lining. We can go into something called lipopolysaccharides, which is basically toxins that are released from some of these opportunistic bacterium. Or you can go on the other side and say it benefits insulin sensitivity. It can help you lose weight, right? We could actually be helping with antioxidants in the system. So let's go through this. So one of the things that we now know is that this microbiome, and there's actually a lot of research going on about this. So with individuals that have diabetes, or any kind of metabolic kind of disorder, one of the things that we're looking into is there's certain strains that have been found to better regulate insulin sensitivity in our system. And so and one of the ways that it's working, and what we know is that it's actually communicating with a lot of different hormones. One of the hormones it's relating with is leptin and ghrelin. Do you guys all know leptin and ghrelin? Leptin is what? Yeah, it's like saying stop, right? Like, it's just like, stop eating, I'm full. Ghrelin, think about G, like as in your stomach is growling, right? This is basically your fasting hormone. So this tells you you're hungry. And so what happens a lot of time, especially in diabetes, what you see is ghrelin levels are actually increased and leptin levels are decreased. So you have an inability to feel full and you're hungry more, right? And this also happens with sleep deprivation. What we know is that changing, right, the diversity of your gut microbiome can actually create or change shifts and create obesity in individuals. What they've done, especially in rat studies, is that they've taken rats that are basically, like, let's say they're equal size and weight, and they've changed their diversity to these parameters. And what they've done is they've been able to kind of just give them ad lib food, and the rats that were changing these specific parameters, they actually became fat, they actually gained weight, whereas the ones that weren't given that were actually, they did not change their weight. So just by changing that creates the fat level in how change the fat composition within the rats, and can change the composition within the viscera. So it's really, really important to understand that just by changing the microbiome, you can actually impact your metabolic rate, right? Or the way that your metabolism actually functions. This keeps going. In arteriosclerosis research, the interesting thing is that now cardiologists are looking more towards this this molecule called TMAO. And so what we always thought was it must be just the animal products and the increase in saturated fats that are then causing a level of increased inflammation within those arterial systems that is causing the plaque to build up. What we now know actually is that animal products, as much as that saturated fat is very important, it is not the entire story, and even more importantly, it's because of the fact that there is something called TMAO that's being produced. This production is actually changing, right? And that's a production by the gut microbiome. We're seeing much more of something called Prevotella, which is a certain strain of bacterium. When we see this increase, right, what we see is we see an increase in TMAO, which then actually shifts how cholesterol is transported out of the body, and that is what's causing the inflammation in the arterial walls. The great thing about this is that when you decrease your animal products, you actually start to decrease or rebalance this microbiome within weeks. Within weeks, they saw this TMA production drop and reversal of arteriosclerosis just with diet changes alone. So this is absolutely reversible, and this is a huge area of research right now in the cardiovascular world for that. When we look at the immune system, as I mentioned, not only do you have that beautiful barrier effect, but what you also have is that it actually affects how you then create a much stronger adaptive immune system. To understand what that is, you have your innate, right, which is, for you guys who have been with me, you guys are getting sick of this, I know, but I'm gonna say it one more time. It's kind of like a castle, right? You have your moat, you have your castle wall. It keeps most things out, right? This is your innate immune system. Your macrophages, your neutrophils, they're gonna be on your front lines. You have your soldiers, which are your T cells and your B cells. It's important to understand these two functions, because when we look at microbiome, not only, right, do we see that within your mast cells, which is one of the innate immune system, right? It's your moat and your castle wall. These actually shift and change and can release a ton of histamine. Has anybody heard about histamine? Right? Why have you heard about histamine? Just yell it out. I've been talking a lot here.
Allergies.
Allergies. Yeah, absolutely. Allergies. So what we know is that if you have pollen, you can have mast cell degranulation and histamine release. What we now know is that with disbalance or with an imbalance in your microbiome, you're going to have a higher level of this dysregulation within the mast cells. So you're going to have more and more histamine release, which doesn't just translate to more allergies, it translates to also food intolerances. So you probably all know some individuals who are like, I'm having trouble eating anything anymore, right? Or this is where somebody who says, I've been able to eat gluten for most of my life, now I can't eat gluten anymore, right? So this is where that comes from. When we look at the adaptive immune system, which is your soldiers, your B cells, your T cells, what we definitely do see is that when we have a lowered biodiversity, we're seeing shifts constantly in how not only do we have memory cells, which are our B cells, which can attack all our viruses that we've had before, but it also shifts that inflammatory pathways. So it's shifting more towards autoimmunity, because you've all heard of your T cells where you have T1, T2, and then you have your Th17. So all of those are being shifted more towards your autoimmune component. I know I'm going over this fast, but this is what I'm talking about. This is like, I'm trying to give you really like snippets into how just vast this is in our body, and how the aspect of your microbiome can affect so many different things in your system. This is just a good representation of just kind of wrapping your head around how leaky gut can happen and how that can be an impact into your gut health, your system health. And it was like we were talking about, it's not just like one dysbiotic event that happens that can shift things, right? Because your cells regenerate. Remember, you're always regenerating, especially your intestinal cells. They're going to regenerate on a pretty regular basis. What happens is over time, and these are different stressors. This has stress, infections, enzymes, antibodies, antigens, deleterious proteins, peptides, any of this stuff. As you increase, as you increase, as you increase, as you keep doing it, as you don't allow these cells to rebuild, and they keep breaking down, what you do is you get from something where you have a dysbiosis, right, which is an imbalance, to something where it starts to actually wear away those beautiful cells, your tight junctions, which are in between these cells, start to break away, and that's where you start to have like food particles and things come into the system, which then cause inflammatory response at that site. So there's a huge inflammatory spot in this intracellular matrix that's in there. So this is how leaky, and this is where leaky gut is. This is where the more and more inflammation you're inciting, it doesn't matter what you're eating, you're just going to cause an inflammation response in the body. This is just another slide that talks about this. So chronic inflammation, and this is what we've been talking about, right? This is what these slides are showing, is that you're setting this up for inflammation. When you have chronic inflammation, this can translate to any part of the body. We talked about autoimmune issues, we talked about cardiovascular issues, right? Heart failure, arterial sclerosis, heart attacks, any of this stuff, right? We know about type 2 diabetes, liver disease, asthma, any kind of infection, right? We know about depression. I talked about Alzheimer's, all of that stuff. Well, yeah.
What about migraine?
What about what?
Migraine.
A huge component in the microbiome. So one of the first things I do with my migraine patients is put them on a diet that actually lowers histamine, high histamine type foods. So those are like your avocados, sauerkrauts, smoked meats, those kind of things, or just meats in general, but smoked meats especially, alcohol products, coffee, those kind of things. Most people definitely are able to reduce the duration and also the frequency of their migraines. Then on top of it, if you're working on hormonal effects, because that's another piece, stress is another piece, which all kind of functions in that realm, right? So yeah. Hormonal health. How are you guys doing? Are you guys okay? Because we're over on time. Are you guys okay? Yeah? Okay. Nobody answered that. Are you guys okay?
Yes.
I'm totally answering for you.
Where do we
you
have
see
to
that?
go?
I know, right? So microbiome influences. This is so exciting for me because I have a large portion of my practice is women's health as well. We now know that it affects estrogen binding sites. It affects estrogen signaling, how we metabolize, how we get rid of estrogen. Same thing with the men. We now know that this has a huge impact on testosterone levels as well, sex binding hormone globulin. It's a major influencer. Where we have the most research right now is actually in estrogen positive breast cancers. We know that now with estrogen positive breast cancers, when we take fecal stool samples, we have less diverse microbiome in these women. We also know, and we now understand that what your liver does, and it's actually fascinating, right? Your liver packages cholesterol and gets it out of the system. So your liver has to be working optimally in order for cholesterol to be regulated as well. One of the things that I always talk to patients about is that if they're eating well and they're just like, why is my cholesterol so elevated? One of the things it could be is coffee, right? Coffee has diterpenes in it, which can raise estrogen level, cholesterol levels. The other thing, it could be just even drinking beer every now and then, or drinking alcohol every night. That might stress your liver out so much that you are able to actually get the cholesterol out of the system, right? It's about producing, manufacturing, and then getting it out of the system. So, and also what's coming into the system. I forgot that one part. One of the things that it also does is it packages, right? Liver takes and it conjugates, it packages estrogen and gets it ready to be put out into your intestines so that you actually can poop it out. So you're able to poop out extra estrogen. What happens though is that in certain cases, right, when you don't have this hormone, it's beta-glucuronidase, basically hormone, when this is actually increased, you are actually breaking apart that package and allowing estrogen back into the system. That is increased in situations where you have less diversity. Does that make sense? I know that I just went really fast. Let me say it one more time. So basically, what happens is that your liver packages estrogen, takes it into the intestines, and basically can just poop it out. When you have less biodiversity, you start to increase this beta-glucuronidase kind of activity, or this enzyme. That increase in this enzyme takes that package that's ready to be pooped out, it unpackages it, and then you have free estrogen ready to go into the system. This is important for the men as well, because when you have a dysregulation of estrogen, you can can then have a dysregulation of testosterone as well down road. And so what we know, and this is just even in vegetarian women, this is in women that are still eating a little bit of potentially dairy as well, but you have 2 to 3 times, right, more estrogen released in their fecal matter than the omnivores. That's huge.
So is that going to be different for postmenopausal women? Is that going to be different for postmenopausal?
Depending upon, no. So no, not in sense of what is happening in the microbiome, but when we talk about postmenopausal women, what another thing is important to understand is that in that sort of a case, you have to recognize that there's a couple of things going on. One is microbiome changes as we start to age, so it's really, really then important for us to make sure that we're doing whole food plant-based diets, right? The other thing is too, you have other factors that are going into it where you're having different, like you're already having a hormonal shift that's being affected in not only the ovaries, but in also every single fat cell that you have because of the different estrogen that you're making. So this overarchingly is not different, but it could be different for those different kinds of factors, if that makes sense. So like if you what I'm trying to say is if you pull back and you did vegetarian women, if you pull back and you do vegetarian women, whether or not it's premenopausal and postmenopausal, you're going to see that they are going to excrete more estrogen on a plant-based diet, is what I'm trying to say to you. But when you take postmenopausal women, there is going to be shifts in how they're releasing estrogen that doesn't have to do with the diet alone.
Right.
Does that make sense?
Do you want more estrogen when you're postmenopausal?
Potentially. It depends. It absolutely depends. Yeah, it depends. Overarchingly, I will say that part of the problem, part of the issue is that you go into postmenopause and your estrogen decreases, but that's actually not the true issue. The true issue is that most women go from high to nothing, right? Whereas if you're actually doing much more even estrogen and it's a gentle decline, there's less of an issue going on. And so when you actually see a decrease like that, what you're trying to do is balance other hormones in effect. That's why it's actually important, even in postmenopausal women, to do a full hormone panel to understand what's going on with progesterone, what's going on with testosterone, what's going on with DHEA, what's happening in the whole system, and where does it need to be optimized. So did I make sense with that? I just want to make sure, because you're right in the sense that there are certain shifts in postmenopausal women that is going to change how estrogen functions, but if we're thinking about just food alone, you're still going to get much more estrogen excretion even in postmenopausal women on whole food plant-based diets. So that's what that was my point with that. There is a humongous gut-brain interaction. So one of the things is, what we see is when we have certain dysbiotic kind of changes in the gut, we're going to see different changes in neurotransmitter patterns, right? Those are the different chemicals coming from the brain. You're going to see vagus nerve, right? The brain-gut connection changes. You're going to see autonomic dysregulation, which is your sympathetic, your parasympathetic, right? You're going to see changes in the amount of those inflammatory toxins that I was talking about before. So you're going to see all of this, which definitely does affect how we're thinking, how we're learning, what are we remembering, right? How are we functioning in normal life? What we know is they've also done different kinds of studies to show, even in rats, there's personality shifts that have changed just with fecal transplants in rats. So you can actually see straight out like these different kinds of attitude changes that are happening when we do this in animal studies. We also know when we look at different brain scans, you can actually, and there's a great doctor, his name is Dr. Amen, A-M-E-N, you probably have heard of him. He's doing some amazing brain SPECT scans, and what he's finding is he's finding changes within these brain scans. I actually want to do one myself. I think they're fascinating. But what we now know is that basically different types of dysbiosis in the gut changes or affects how our brain looks in these different specs due to like serotonin deficiency, dopamine deficiency, changes in all our different neurotransmitters, which of course translates to anxiety, depression, OCD, different types of quote unquote diagnoses. Oops, where are we going? Some of this I just wanted to, this is just a list of different kinds of neurotransmitters. One of the big things that I want to bring up too with the with water fasting specifically is that, as many of you know, it actually increases something called brain-derived neurotrophic factor. And brain-derived neurotrophic factor is a name for a fertilizer. You can think of it that way, right? It's not really a fertilizer, but it's kind of like a fertilizer for neurons. So the beauty of fasting, whether it's intermittent fasting or long-term fasting, is that it boosts this beautiful, beautiful protein, which actually helps to, it basically allows neurons to grow. So you increase neuroplasticity. This is how we're able to change. This is how we're able to think. We're able to have better memory, right? We're able to make different kinds of connections. So that's one of the powers that water fasting does have. The other thing that I was talking about, and I'm just going to kind of quickly just talk about this, is that autism is a pretty multi-dimensional type of kind of, I want to say, condition that comes up. And it's through the research I've done, it's not just one thing, but it's a combination of different things. The thing that is coming up more and more is that there's a very central component that is in a dysbiosis, or there is some kind of changes within the microbiome. There is definitely sometimes a genetic susceptibility. Environmental factors are hugely involved in it, but it definitely depends upon how they come together and then what they do in the gut or in the microbiome, which is what ends up as the condition. And there's a lot of research being shown that different changes in the microbiome are much more prevalent in autistic children. So there is a lot of research being done in this. So this is just one other aspect of it. But anyway, back to just in the last little piece, what I'm just going to talk about, because you heard me talk a lot about different things. At the starting point, this is very general, so this is something that you might want to work deeper with your doctor on. But you know, the big things, we talked about plant-based diet until I was blue in the face, right? We talked about water fasting is hugely impactful. Stress is a really big component. We do know that not only does it help with growing bacterial, does it increase bacterial growth, it can actually strengthen biofilms, which are these scaffoldings that bacteria put up. It actually increases aggressiveness, right, of your opportunistic bacteria as well. So there is a big component where we really want to focus on stress management. Things like laughter, community, what I was talking about with changing neurotransmitters like oxytocin is hugely impactful, not only on stress, but how your microbiome functions. Exercise is really important, especially for motility. So you really want to be moving your gut, which is one of the best ways is through exercise. In addition to, we now know exercise creates something called myokines. Myokines are these amazing molecules that actually help kind of rebalance your neurotransmitters. So they're kind of like this hope, they're calling it a hope hormone. So they're actually fantastic. Intermittent fasting has gotten a lot of research. So time restricted feeding window, alternative day fasting, 6 and 1, 5 and 2, anything that you want to do, just getting in there and not eating constantly throughout the day is going to be really helpful as well. There's different nutrients that are going to be really helpful for microbiome health. These are just some of them. The sulfurs are going to be in your brassica family foods, which are your broccoli, your cauliflower. Yeah.
A friend of mine is taking sodium butyrate. Is that beneficial or safe?
Sodium butyrate basically is a compound that is very helpful in feeding good bacterium to release short-chain fatty acids. So it's one of the things that helps to basically heal the gut lining. So it's something, if somebody has leaky gut or something to that effect, or dysbiosis, it's something that's really helpful. I don't think everybody needs to be taking it, but it's something that's really definitely very good. Probiotics are one of those things that's very individual based. I would not recommend it across the board. Like I said, it's really, now that you understand a little bit about the microbiome, it's one of those things that's like, I would give it if I'm trying to affect change through treatments and the person needs a little bit of support as we're doing that. Here's a perfect example of how I've used probiotics. I had a patient that had ulcerative colitis. She was in a flare. She was bleeding. You know, she had multiple bloody stools a day. She had abdominal pain. We were trying to get her off the prednisone so that she can come in for a fast. As she's coming off the prednisone, that's where I was using pretty high doses of probiotics in addition to some anti-inflammatories, so that as she's coming off, I had more of a barrier for her, and she came off of it and she was able to do a water fast. So that's like a situation. If somebody just went through pretty intense antibiotic treatment, I would probably use multiple probiotic strains in order to kind of help rebuild them as they're eating healthy, as they're working on their stressors. So there's different scenarios. I wouldn't.
Doctors are recommending it every day.
I would not take probiotic. Is probiotic, if you're taking probiotic, it's just like taking anything else. You have to ask yourself why. Why are you taking it? Even supplements. I'm not a big supplement pusher. It's like, why are you taking it? Why do you need it? And do you really need it, right? Most of us in here, if we're gonna be choosing whole food plant-based, you're gonna have to take a B12. That is a great thing to be taking, right? Most of us cannot, probably 99.9 of us, it's really hard to get D through the sun unless you live at the equator. So doing like vitamin D is probably really important, but different things like that, you know, yeah.
How do you feel about kombucha?
So kombucha, you have to be careful with it. So there's enough sugar in there that it absolutely can cause candida and yeast overgrowth. So I've had actually, believe it or not, I've actually had a patient that had severe GI issues, and it was because of overdoing it on kombucha. So if you're doing it every now and then, no big deal. Like if that's your drink of choice, much better than alcohol, right? But if you're doing it every single day, multiple times a day, I would absolutely tell you not to do that. So yeah. Fecal transplants, the only few, yeah, go for it.
I was just gonna ask about fermented foods
Mhm.
and water kefir.
So fermented foods are fantastic. The only issue I have with fermented foods is many of the times, in order to ferment, they have to put a large amount of salt in there. They have to put a large amount of salt in there. What I would do is if you can ferment your foods without the salt, you know, that is the best way. Many cultures around the world, actually it's a main staple of the diet. The only times when I wouldn't do fermented foods were in certain cases of IBS, and also like SIBO cases. I just wouldn't do it right off the bat. It's something that I bring in later on. So, but yeah. Fecal transplants are being talked about in the medical community, and there is a lot of research supporting the benefits of it. It's something that I would absolutely prescribe. There's good research around it. We were talking about probiotics. If you are taking probiotics, the one thing I do recommend is to rotate them, because of the fact that, as you can imagine, one probiotic, even though it has billions of organisms, it only has a certain amount of strains in it. So you want to be rotating them, and it's really important to take it at night. If you're taking it with food, you are not getting the benefits of the probiotic at all. Antimicrobials every now and then are really good. People ask me all the time, but isn't that going to kill off, you know, a lot of the good bacterium too? Remember that most herbs, just like whole food plant-based, has these amazing component to do what it says it's going to do, like it's antimicrobial in nature, but it has all these overarching benefits too, like it supports other aspects of the gut health, or it supports the liver, it supports the adrenals. So it's kind of working in tandem to do what it needs to, and also helping other aspects. So when you talk about herbs are definitely much more, I recommend herbs much more over than like antibiotics per se, unless if you need antibiotics, you need antibiotics. But and then yeah.
Where would colloidal silver fall on that?
Colloidal silver is more like an antibiotic. Like, so colloidal silver is much more of like a very direct killing agent. Antimicrobials are more like berberine, or you know, like Oregon grape, or taking something like oregano, you know, leaf, that kind of thing. So, but colloidal silver, like it's a killer. You know, that's all it does, basically. It doesn't have any other kind of function. Other things to think about is just getting dirty or having your kids get dirty. That's one of the other things. Absolutely on farms, they've actually noticed lower rates of asthma, lower rates of allergies with kids that are not only around animals, but that actually play in the dirt. You can do this too. Go play in the dirt, garden, right? That'll absolutely increase your biodiversity. And then we talked about just gut health is the same exact thing. So eat more greens, work in the garden. Probiotic lotions, there's not a lot of good research on that. I wouldn't go there first with individuals that have any kind of skin issues. It's really working from the inside out. So anyway, with that, the end. I'm so sorry. I kept you guys so late. So thank you.